Hello, welcome to the COVID-19 Vaccination Centre. We're pleased to see you here. It's very, very important you come forward and get your COVID jabs because we're approaching winter and seasonal viruses are everywhere. So we're going to show you through the process to give you the confidence to come forward and get boosted. When you arrive, we'll ask if you have an appointment or if you're just here to walk in. If you have a booked appointment, we'll print you off a label with your details on it and ask you to stick this to a consent form. Once we've found you on the system, we'll give you a short form to fill out. Don't worry, we can help you complete this if you get stuck. The form will ask you some questions about your medical history to make sure that we give you the right vaccine that is the most effective and safest for your age group. Next, you'll see a clinical assessor. We're the doctors and nurses working at the surgery and on the vaccination programme. We'll be able to talk through any concerns and make sure that you're eligible for the vaccine, and we'll check your responses to the medical questions to ensure the vaccine is given safely. We'll ask questions to make sure you don't have any allergies that might lead you to having a bad reaction to the vaccine, and we will make sure that you get the right kind of vaccine.
Do you have any questions for me?
Why do I need the booster when I've already had the vaccine last year?
That's a really good question. If the answer is, the booster itself will bring up your immunity to a level where you can fight off the infection a little bit quicker. So if you do get unwell, some of the protection you will have got from last year will have waned a little bit, so it will have gone down. So this will help you fight it off a little bit quicker.
And will I feel ill after the booster?
Some people feel unwell, some people feel completely fine. You might feel a bit fluey for a day or two, but you'll feel better than if you had the COVID infection itself.
We will then make sure you are directed to the correct vaccinator who can give you the vaccine that the doctors have recommended. Now you've reached the vaccination room. You'll see one of our team of highly trained specialist vaccinators. This is what we do all day, every day, so you're in good hands. Before we start, we'll check over your paperwork and look at the record on the system.
Hiya, it's Catherine, isn't it?
Yes.
Yep, hello, so my name is Lee. I'm going to be your vaccinator for today. And how are you feeling today?
Anxious.
Anxious? Any particular reason why at all, or?
I'm not great with the needles.
Okay, that's completely normal. We get many people with needlephobia, from kids to adults. That's completely understandable. I don't think anyone normally would like needles, if I'm being honest with you. But it's a very quick process. So what we're going to do is to target the deltoid muscle. So it's just the muscle on your upper arm here. It's just be very quick. I'll be out in 3 seconds, probably not even that. It's just a little pinch. Sometimes you don't even feel anything.
Is it a big needle?
No, we use a very small needle, so you won't feel anything apart from a little tiny pinch, and that's really it.
My anxiety levels are quite high,
Mhm.
so I'm not sure I might be able to go through with the vaccination.
That's completely, usually, like you said, people get anxious before the actual thing starts. That's completely normal. Usually recommend patients to take a nice deep breath and hold it for 3 seconds, and let it out. Wonderful. Sometimes we also get, especially little children, to grip their arm nice and tight so you engage the whole muscle until it just relaxes by itself.
And is that in the arm you're going to...
Yes, usually it's the arm that we plan to just nice and tight for about 30 seconds so you can feel it. So when you start gripping, you start to feel a little bit. And usually that gets nice and relaxed. And yeah, usually I tell my patients to sing, to rap, just to talk to me. That's also whatever makes you comfortable.
Because I get told to relax, but I immediately tense
Tense up.
So I don't know if there's a technique for that we can help with.
Usually I move around the patients. I just get ready. I'm like, just my free hand. I'm just going to put my hand on your shoulder. Whenever you're ready, if you want to give me the okay, or you just don't want me to tell you, just get it done.
I'd much rather you just don't tell me and just do
Yeah,
it.
that's absolutely fine. I usually just ask my patient anyway, and that's usually how it goes. I'm like, some people like to go 1, 2, 3, and some people just nothing at all. And that's...
If all is well, then we'll get you to relax your arm and administer the vaccine into the upper part of your arm. And that's it. Thank you for coming for your vaccination. Please just avoid driving for 15 minutes. Otherwise, you can expect to feel poorly for a couple of days perhaps. And then if you have any questions after that, let us know. Thank you very much for coming.